I mean, and Sanjay, what other medications? I mean, he was in a whole, on a whole list of a cocktail of medications besides propofol. What other medications do you know of, Sanjay?
Well, I mean, the ones that that you think of in a situation like this. I mean, but Ativan is one. Versed is another one. Benzodiazepines, as Travis mentioned. He was also taking Valium, which is a powerful muscle relaxant, and he got several of these medications in the hours before he died. One thing I want to point out as well, that was an audio recording. I think that a lot of people question, why did the recording exist at all? Was there some sort of purpose in getting the recording? But what was interesting was that was played by the prosecution to sort of show how many drugs, how many different medications Michael Jackson was getting, what the effects were. What the defense sort of contended as well was, look, this is a man who's obviously taking a lot of different medications, but he's still awake. He can't sleep. And that was Dr. Conrad Murray's challenge, was despite all those medications, the man, Michael Jackson, still couldn't sleep. So the same audio recording, and you have prosecution and defense interpreting it in different ways.
Interesting. Now, Sanjay, another point that's come out is that Dr. Murray allegedly was using not the improper CPR technique. What do you know about that?
This was stunning because he is a cardiologist, so he deals with the heart. I mean, that's his area of expertise. What we know is that a couple of things. First of all, he was performing CPR at least at one point with just one hand. He was literally just with his left hand sort of pushing on his chest like this, and he was also doing it while Michael Jackson was still in a soft bed. And for anybody who's taken even basic CPR training, those are two major mistakes. First of all, you have to really be using both hands, pushing down on the chest, really getting adequate compressions. And the second thing is you can't do that on a soft surface because you're never going to establish those adequate compressions. What the defense is arguing, just to that point, is they're saying, of course, Dr. Murray knows how to do CPR, but he realized when he came back into the room that Michael Jackson was no longer alive. So he realized that anything he did was just a futile attempt. So he was going through the motions, but not expecting it to have any impact.
And this is something else that I had read from the treating emergency department physician, was that Dr. Murray asked EMS and everyone to go above and beyond and to continue resuscitative measures even though it seemed futile.
Obviously, it's very difficult to figure out what was going on in his mind exactly. Why at one point did he essentially seem like he gave up and did not call 911 quickly, was not performing adequate CPR, and on the other hand, he really pushed the paramedics not to pronounce Michael Jackson dead at his home. And then even when he got to the hospital, Travis, it was amazing. There was a remarkable sort of effort by the ER doctors over there, including putting in an aortic balloon pump, which, as you know, is something that essentially simulates what the heart should be doing, trying to pump blood to the rest of the body. Dr. Murray was really, really encouraging them to be aggressive at that point, but none of it worked. And the ER doctors who are testifying said, look, we really didn't believe any of it could work because of the state that Michael Jackson was in when they first saw him.